With the 2018 midterms coming up, it is of no surprise that the number one issue for voters is healthcare. I recently reached out to Charles Gaba, founder of ACASignups.com, to talk about the Affordable Care Act that former President Barack Obama passed all the way back in 2010. In this interview, we talk about what motivated Charles to start ACA Signups, what the ACA is, and various other parts of our healthcare system. I hope you enjoy. Thank you. What got you interested in healthcare?
Doctor, and I was pre-med back in college for a couple of years, but really, that was 30 years ago. Really, it was not so much the healthcare side, so much as I'm a website developer, and I'm also a data wonk. So back, and I have been, I'm a political activist and such as well. So back in 2013, when they were getting ready to launch the healthcare.gov and the ACA exchanges, I was kind of interested from all three angles because as a website developer, I was, when they launched in October 2013 and they had all the technical mess, they having so many problems with at launch, that I was interested in at the time. And
you're talking about healthcare.gov?
Yeah.
Okay.
The ACA exchanges, right. But it wasn't just that. It was also a couple of the state exchanges were having a lot of problems as well. So, but the one that got all the attention, of course, was the big one at healthcare.gov. And so I was interested in that from a technical side, but also, like I said, I'm a data wonk. So I was really, after all the fuss and all the anger and arguing and, political blood that was poured, that was spilled over getting the law up and running, I thought it would be nice to know exactly what, how many people were actually using the thing, how many people were actually signing up. And it seemed like a little thing, but I was amazed to find that nobody was talking. There was no hard data on how many people were actually signing up that first year. The government wasn't really talking because, frankly, they knew that the numbers stank because they were having all the technical, problems. And the major, news media wasn't really covering it either. Or if they were doing a really lousy job of it. And so I just decided to do it myself, and that's kind of how it got started. It was really just more of a crowdsourced, sort of collating, just compiling data, really. And it just sort of grew from there. It was just supposed to be a hobby. It wasn't really supposed to be like a career or anything. It was just something this kind of nerdy hobby thing I was doing in my spare time, and that quickly kind of overtook everything. And now it's almost 5 years later, and I'm still doing this nonsense. So,
as the creator of ACASignups.com, did you ever get acknowledgement from the federal government for doing all this?
Oh, from the federal government? No.
So.
Oh, wait. You mean acknowledgement?
Yeah.
Sorry, I thought you said pay.
No. Acknowledgement. Did the government ever acknowledge this?
Yeah, sort of. Individual. I have never reached. I didn't get to go to dinner at the White House or anything, but like I said, I did get I got that one reference from that one that White House advisor during that interview. I've had individual members and now former members of the Obama administration have given me some nice things. Andy Slavitt is the administrator of the Centers for Medicare and Medicaid, and he and I we talk every once in a while, and he says some nice things about me from time to time, and that sort of thing. Most of the people who a lot of former officials and administrators, because of course that was not enough anymore. No one from the Trump administration has called me up or anything. Although, oddly enough, I actually did get last year I was cited once in a press release from Trump's HHS, communications person. They quoted me completely out of context about something having to do with premium increases last year, because they issued a big report that was trying to prove how insanely expensive, rates had skyrocketed under Obamacare. And I looked at the report, and my response was basically, yeah, they have gone up, but here's why. And that's when I went to the whole thing about pre-existing conditions and all that. And they just took the yeah part. They were like, even Charles Gaba says yeah, rates have increased.
So they basically doctored your statement, cut it off to why it's going up.
Yeah, well, it reminded me of you'll see like a blurb for a movie. It'll be have some film reviewer who's like, "This movie, ... awesome," and the actual full quote was, "This movie is not awesome."
When the 2008 presidential primaries were going on the Democratic side, you had Obama and Hillary talking about universal health care. Were there any differences in the plans they were pitching at the time?
Well, I wasn't paying as much attention to it at the time as I am now. I wasn't quite as focused, but if I recall correctly, the main difference, they were actually pretty close in what they envisioned in most areas. I believe the biggest difference was, ironically, the individual mandate. Because I remember in particular there was one there was one debate in particular, the primaries, where it got kind of heated, and it had to do with whether or not there had to be an individual mandate penalty or incentive of some sort to get people to sign up for policies that they had in mind. And Hillary Clinton was actually the one who said, Obama was basically saying, we don't need a Band-Aid. If we make them, inexpensive enough, if we make them good coverage at a reasonable price, everybody will sign them, because nobody would willingly go without, as long as they could afford it. And Hillary was the one who was saying, like, no, dude, like, I've talked to actuaries, I've talked to, like, every expert in the field, and they've all said, no, you've got to have some sort of penalty. And here's the reason why, is because, parallel's not exact, but think about your auto insurance, right? Or homeowner's insurance. If you want to drive a car, in pretty much every state, you have to have insurance, right? When the police officer pulls you over for speed or something, what do they ask for? They ask for your ID, your registration, and your proof of insurance. Why? Because that's the incentive. The incentive is, if you want to drive this car, you got to have insurance. And the same thing with a mortgage for your house. If you want to get a mortgage, no bank is going to give you a mortgage for a house unless you also have homeowner's insurance. And the reason for that is because what they don't want is for you to go around without any sort of coverage until you crash your car or until after your house catches on fire, and then call up the insurance company and say, hey, I need to buy a premium. And by the way, I have a $100,000 claim. Same thing with health insurance. The idea is that if you basically require people to buy it, then it'll prevent them from having no health insurance for months after month or year after year, and then all of a sudden one day they get diagnosed with cancer, and that's when they call up Aetna or Blue Cross or whatever and say, hey, now I need a policy, and by the way, I need $100,000 in chemo. Because the problem is when you do that, basically means that the premiums go through the roof, because basically the only people who are going to be signing up are going to be people who are really sick, and who are more expensive to treat. So that was, I believe that was the biggest difference between the two at the time. And eventually, after he was elected, eventually Obama came around and said, okay, well, we'll add the mandate penalty. And that, as you may recall, was, for all the complaints and all the fuss that people made about the ACA, the single biggest rallying cry for the Tea Party and all that in 2010 was the mandate penalty. They were tyranny, freedom, and all that sort of thing. How dare you tell me that I have to do this, and that sort of thing. So, and then, of course, a decade later, well, here we are. They got rid of it, and guess what's expected to happen because of that? Rates are expected to go up about 10% because they got rid of the mandate. So there you go.
All right, so you've talked about how the 2012-2013 New Year, correct, was, it's supposed to be the new year for healthcare, but the ACA got passed... 2014, okay, sorry. So the ACA was passed in 2009. So what was healthcare before 2014?
It was actually signed into law in 2010, but yeah, for that, there was like a 3 or 4 year period in between it was actually signed into law and when the exchanges actually launched. There was a 4-year period because there was a lot of other stuff going on behind the scenes, sort of a lot of prep work. But most people, when they think about when the ACA really went into effect, that would be January 2014, because that was when the exchanges launched, and that was when the Medicaid expansion went into effect and all that. So, but yeah, before 2010, and I know it's hard for a lot of people to remember this, but yeah, it was basically, the biggest changes were to, obviously this Medicaid expansion is the big one, and then the other big one is the individual market. There were changes. The law did make a lot of changes to every aspect of healthcare policy for everyone, But like if you're on an employer plan, the changes weren't quite as obvious. And if you were on Medicare or if you were already on Medicaid, the changes weren't, quite as obvious. And that's like 2/3 of the country right there, And it's really the individual market for people who are either self-employed, like myself, or who, they work for someone else, but their employer does not provide healthcare benefits. That's the individual market. And at the time, there was around maybe 11 million people or so. And then, of course, there were about 40 or 50 million people who didn't have any coverage, right? And, so there were really two ways that it cut into, it kind of chopped down on that uninsured rate. The most obvious one was Medicaid expansion. They raised the income threshold for adults, and today there's about 15 or 16 million people on Medicaid through the expansion program. And then the other way is, again, there's several million people who've gained coverage through the exchange system. And that, again, that's where about 80% of the controversy and confusion was because of the individual market, because of the changes there. And the thing is that before the ACA, you hear a lot about pre-existing conditions, right? And that was the biggest thing, because if you're covered through your employer, for the most part, if you go to work for a company and the job includes benefits, once you're in, there might be a waiting period because, you're still on a trial period with the company, but generally speaking, once you're in, and then you're covered through their health plan, and generally that's basically it, and so if it includes coverage for your family, then they're covered as well. But if you're on the individual market, you had to go through hell to get covered, because they would ask for your entire medical history, every operation, every, prescription, every procedure, every doctor's visit. There were people that they would just ask for everything that you've ever had, and of course, you had to come up with all that information. And it might be from a doctor you didn't see, you saw 15 years ago. They may not even be in business anymore. So you had to gather up all these X-rays and records and stuff, and then you send them to the insurance company, and they say, well, hold on a minute, and they would review the whole thing. And if they wanted to, they could just say, sorry, we think you're going to be, basically have a pre-existing condition, so we're not going to cover you. And that was that. And so that was in some cases. In other cases, they would say, okay, we'll cover you, but we're going to charge you like 10 times as much as we normally would, because, we think that you're high risk of having cancer or, diabetes or, whatever, because they thought you were, they figure you're going to be a high risk, you're going to be really expensive to treat. So they would either not cover you at all, or they'd cover you but charge you a fortune, or they might say, well, we'll cover you, but we're going to add an exception to your policy that we won't cover you for the one thing that you need us to cover you for. Well, we'll cover you for everything except for diabetes, because you have diabetes. So there was a lot of that nonsense going on, and so there were millions of people who they were simply uninsurable, sometimes at any price. And that was one of the main things the ACA did, was it said, okay, no more of that. Going forward, insurance companies have to cover everyone regardless of their medical history. And that's where sort of, a lot of both the good and the ugly came from after that.
One of the things that was pitched with the ACA was that if you liked your plan, you would keep it, and then we found out that people lost their plans. What exactly happened there?
Well, yeah, so there's two things about that, or a couple things. The first thing is that, quite honestly, you shouldn't have said that. And here's why. And this has nothing to do with the law, with the wording, or the specifics of the law itself. It has to do with the fact that there was no way to guarantee that, for the same reason. It would be like if President Obama, if he had gone on camera and said, Apple will always sell the iPhone 6. That if you like your iPhone 6, Apple will continue to sell it forever and ever. Well, there was no way to guarantee. Of course they weren't going to. These are companies go out of, for one thing, they go out of business. If you like your plan through your current insurance company, well, what if they get bought out? What if they merge? What if they go out of business? Guess what? Then you lose your plan. Well, he said I could keep my plan. So part of it is that. But the other thing is, I know what he meant. Okay. what he meant was this. The Clintons, under President Bill Clinton, he and Hillary Clinton, they got burned badly when they tried to impose a universal health care coverage program back in the early 1990s, right? I'm not sure how old you are. I don't know if you remember that. But they tried to do universal health care in the early 90s, and they got torn to shreds over it. And one of the main reasons is because half the country is covered through their employer, another big chunk is on Medicare, another chunk is on Medicaid, and then you have a small slice that's on the individual market, and then of course you have those who aren't covered at all. And they were intending at the time to replace, to overhaul the whole system, right? And people freaked. And so what Obama, his larger point was that, again, as I mentioned earlier, the ACA, it made changes to the employer market, but they weren't structural. They were sort of around the edges. It made changes to Medicare, it made changes to Medicaid, but in all those programs, for the most part, it's sort of left, pretty much in place. The only area where it made major changes was with the individual market, and even then, the insurance companies had 4 years. Remember, it was signed in 2010. They had until 2014 to get their acts together and to basically to get their to replace their policies with these new compliant ones, right? And most of them, what they did is they basically waited, they waited as long as they could, and then they made the changes all at once, starting in 2014, right? They waited until they absolutely had to. And so what happened was there were about 5 or 6 million people. Like I said, the individual market was around 11 million people at the time. And of those, some of those people were actually allowed. There was a grandfather clause that literally said any policy that you're enrolled, if you enrolled in this policy before 2010, before the law was signed, you can stay on it as long as the insurance company keeps offering it, right? There's no guarantee that the insurance company isn't going to just decide on their own to stop offering it, but they didn't have to, right? They were still allowed to cover through it, and the insurance company was allowed to continue offering it as long as they wanted to, but only for those people. But there was another about 5 or 6 million people on the individual market in fall of 2013 were on policies that they had enrolled in after 2010, right? Sometime in the last 3 or 4 years. And those are the policies that were not compliant with, they did not have guaranteed issue, they did not cover all of the essential benefits and so forth. And I was on one of those myself. My wife and I were on a Blue Cross policy here in Michigan. And we received one of those scary notices. You remember the ads that showed people opening their mailbox and, oh, you've been canceled. And we got one of those from Blue Cross. And what it said was, your current policy is not compliant with the new health care law. We'd like to invite you to, visit this new, healthcare.gov, where you can shop for one that is. And in our case, it wasn't that big of a deal. We took our old policy, ended on New Year's 2013, and we replaced it with a compliant, with basically whatever the closest equivalent was. And, in our case, it cost more, but it also covered more stuff. It covered mental health and some other things that weren't on our old plan. We took it in stride, partly because it wasn't that major of a change from our old policy. It didn't cost that much more. But there were several million people who, in some cases, it wasn't, something more like us where it wasn't that big of a change, but in a lot of cases, their current policy that they liked, right, or they said they liked, was basically, in some cases, was kind of a junk plan. Maybe it didn't cover much of anything, but it was cheap. That's the thing is, the less it covers, the less expensive it is, right? In other cases, they were decent policies, but they were, again, allowed to cherry pick. So if you had pre-existing conditions and so forth. So, and they freaked out, and I'm sure you remember that. In October, November 2013, people got these notices, and they freaked out. And part of the reason was because, again, Obama had said over and over again, if you like your plan, you can keep it. What he should have said is, 99% of you, if you like your plan, you can keep it, But he didn't. He made it sort of an unequivocal, across-the-board blanket statement. And there were several million people who that did not apply to, and they were pissed. And they were so upset that the backlash was so intense that Obama instructed the HHS department to issue a policy waiver, basically, that said, okay, if you enrolled in one of these plans between 2010 and 2013, then you will also be grandfathered. They call it grandmothered plans instead of grandfathered. But basically, they gave them a 1-year extension. They said, okay, you get 1 extra year, and then that 1 year eventually became 2, and then 3, and now it basically amounts to a grandfather plan at this point. I don't think they'll ever, officially cut the cord on that. But those numbers have been dwindling ever since because, again, that was only for, no one new could sign up. It was only for the population. And over time, people did drop those plans because, maybe they got a job and they switched to employer coverage. Maybe they turned 65 and now they're on Medicare, and so forth. So those numbers have dropped down. I think they're down to about 1 million or so, give or take. Seen some estimates. But yeah, so that's what happened there.
All right, so we've talked about the private market and the exchange market. So can you tell me what the difference between these two are?
Well, the exchange market is part of the private market. That does cause a lot of confusion because the thing is the exchanges, the healthcare.gov for most states, and then again there's about a dozen states that have their own. Were you based out of Florida, is it?
Yes, South Florida.
Okay. So Florida is covered through healthcare.gov, so is Michigan, where I'm at. But there are some states like Michigan and New York, like California and New York, that have their own exchange website. But basically what it is, they're private health insurance plans, which are sold through a government website. It's basically the same marketplace run by a government entity where they, you can sort of, compare and contrast, do side-by-side shopping and all that. But the policies themselves are still private policies. They're the same policies, through Blue Cross or Aetna or Medica or Molina or, whatever the insurance company is. They're the same policies that you would buy or that you would be able to buy directly. It's just that you're doing it through the exchange website. And the main reason why people buy them, some people do buy them directly even now. The difference is that if you want to qualify for the tax subsidies, for the financial aid to help pay for them, you have to do it through through the exchange websites. And that's because they have to be able to verify your identification, verify your income. They have to verify a whole bunch of nosy stuff that the government has a right to know, but that a private company isn't supposed to. They're not supposed to be snooping around your IRS records and that sort of thing.
Yeah.
That's why you do it through the exchange sites. So the financial assistance comes from the government, but the plan itself is a private plan.
Okay, so you're talking about subsidies. How do you fall under qualification for a subsidy?
Okay. So again, the way it was mainly a sort of a two-tiered approach. The first was Medicaid expansion, which is a lot simpler. Basically, there used to be a certain income threshold that you qualified for, and it varied by state. Right? Some were higher, some were lower. And then what the ACA did was it said, okay, anyone earning up to 138% of the poverty line, which is that's around like $17,000 a year if you're a single person, about $70,000 a year for an individual. Anyone up to that, you're on Medicaid now. Right? And there's about 15 million people who fall into that category. The problem with that is that, of course, the Supreme Court said that it had to be up to the state, and so some states did and some states didn't. So not every state did, right? But the other half of that was the subsidies for the exchange, and the subsidies, that is if you fall between 100 and 400% of the poverty line. There's actually an overlap there for some reason with the Medicaid population. But basically, if you earn between around 12,000, I'm talking for a single person with no kids. Okay, if you earn between $12,000 and $48,000 a year, and it's between 100 to 400% of the poverty line, then you qualify for subsidies, and it's on a sliding scale. It's based on a percent of your income. It starts out at like 2%, and then so if you earn like $12,000 a year, then you only have to pay like 2%, and anything over that, you get a subsidy for. If you earn like $48,000, high end of that, then it's like 9.5%. So, if you're buying a policy that costs 12% of your income, then that 2.5% of that or whatever would be. So you might receive a subsidy for like $50 a month or $100 a month. At the upper end, and it might be several thousand a month even if you're at the lower end. The problem is if you're above that 400% cap. So let's say you earn $50,000. Like if you earned $48,000 last year, but you earned $50,000 this year, all of a sudden you don't get anything. And okay, your income. So like you're earning $2,000 more, but you might have just lost like $3,000 in subsidies. So you can actually potentially come out behind because you earned a little bit more. So that's a problem.
So what's the difference between Medicaid and Medicare?
Sure. Well, the simplest way to put it, and I mean there are a lot of differences, but really the simplest way to put it is that Medicare is a federally funded, mostly single-payer program. The reason I say mostly is because it's mostly financed through federal taxes. One of the things that a lot of people don't understand is that there are premiums, deductibles, co-pays, and so forth for Medicare, just like there are for private insurance. It's just that those premiums, deductibles, and co-pays tend to be a lot lower because the taxes are paying for a much higher percentage of your care. But yeah, basically it's effectively a single-payer healthcare system, mostly for senior citizens. It was originally for Americans over 65 and older. Later on, they expanded it to include some people who are under 65 who have certain conditions. I think it's like ALS and end-stage renal failure, and there's a couple of other things. So I think there's several million people who are under 65 who are on Medicare as well. But it's basically a single-payer program for senior citizens. Medicaid is it's also a single-payer program, except that it's really more of a dual-payer, I guess you call it, because it's the funding. It's managed by the states, and it's financed by both federal and state dollars. So it's usually around a 2-to-1 ratio. About 2/3 is covered through federal funding, and the other third is through the state. And Medicaid is primarily for lower income people, people below a certain income threshold. And it varies by state. And there's some states that have several different programs. There's one for children. There's one for, pregnant women. There's one for, adults. There's one for people on disability. But it's basically based mostly on your income level. And so there are some people who are actually on both Medicare and Medicaid, because if you're a senior citizen who's also low income, then you probably qualify for both. One will cover what the other one doesn't. Medicaid usually covers just about everything. It might cover like 98% of, your typical enrollee's healthcare expenses. Again, it varies by state. There are some states where you do have to pay small co-pays and so on, but for the most part it covers just about all your expenses. And I mean, there's a lot of other differences as well, but those are sort of the two biggest ones.
Okay, so with Medicaid here, do all places take it, or can that be pick and choose?
That's always been one of the Achilles heels of Medicaid, is that it's a great program for the most part, but one of the biggest things that people complain about is that there's a significant chunk of doctors who either don't take Medicaid patients at all, or they put a limit, like they take a certain number and then they won't take any more after that. And the reason for that, one reason is because it's my understanding that there's a lot of paperwork headaches, and there's I guess the red tape. It's kind of convoluted. But the biggest reason that I keep hearing is because, frankly, Medicaid only pays about half as much as private insurance does to the doctors. So, if you're a doctor and you could take 8 patients a day, and if they're on private insurance, then you're going to pay you $100 per visit, and if they're on Medicaid, you're only going to get paid $50. Well, you're probably going to want the ones who pay more. So that's part of the thing about Medicaid is that it's very cost efficient, but part of the reason for that is because it doesn't pay the doctors and the hospitals nearly as much as the private insurance. So the same thing is true of Medicare to a certain extent. Medicare pays, I think it's around 80% as much as private insurance. So there are a lot of hospitals and doctors that tend to discourage Medicaid enrollees or Medicare enrollees, and they encourage people to have private insurance instead because again it pays more.
Okay, so you're talking about that there's counties that do not offer health insurance.
Well, there was a risk of it. The last couple of years, there were a lot of scary stories where it looked like there wasn't going to be, and then at the last minute, somebody jumped in.
So there's some counties that literally only have one insurance cover.
Well, remember, we're talking about on the individual market specifically. We're not talking about
through work or anything.
Coverage.
Okay.
I mean, there are probably some areas where there's only a couple of employer, companies offer employer coverage as well. But mainly when you hear about that, what they're usually talking about is the individual market. Again, for people who are self-employed or who are not covered through their employer.
Okay. So there's the individual market and the ACA market are the same exact thing, and then you just have employer coverage.
Well, there's really on the private side. There's really three main markets. There's the large group market, which is for large employers and they have more than 100 employees, right, big corporations. There's the small group market, which is for smaller employees, basically under 100 employees. And then there's the individual market, which is, again, for people who are self-employed or who work for a company that does not provide it themselves.
Okay, so there's no law basically saying that they have, that there at least has to be one insurance carrier. At least a federal law, I should say, on the individual market.
Right now there is not, and that was always a problem. I remember talking to my wife back, when they first passed the law, and I was reading up about it. I remember talking about that and saying, what happens if theoretically none of the insurance companies happen to want to, to cover? Because the thing is that it's not statewide either. There are some there are some small states like Delaware or Rhode Island where it's a really small, state, and where it's like if you cover if they're offered in the state, the whole state. But in larger states, they have multiple rating areas. So like Michigan, for example, might have 6 or 7 different rating sections of the state, and so Blue Cross or Aetna or Health Alliance Plan or whatever, they might only cover the Lower Peninsula, or they might only cover the west side of the state. And so it's possible theoretically that you could have let's say you have usually a rural area where there's very few people that live there. It's maybe in South Dakota or Wyoming or something, where there might be a huge area where there's only maybe a few thousand people who live there, and the insurance company just none of them think it's even worth the bother. It might be just more of a headache for them in their view to provide coverage in that area, or maybe there's just not enough doctors. There might only be one doctor for 500 miles, and there was always a risk of for various reasons that they just might not be interested. And I always wondered, well, what happens if that happens? And fortunately, it hasn't happened yet, but it's come very close. So, and there are plenty of ways to fix most of these problems, and they've been presented, by mostly by Democratic senators and members of Congress. And some of the states have actually taken action to fix some of these issues. One idea to fix that problem that I suggested a couple of years ago, and which has been presented, Elizabeth Warren suggested it last fall, I believe, which is to tie the Medicaid contracts to exchange participation. That is, most people in Medicaid, about 70% of the people enrolled in Medicaid are actually enrolled through a managed program, where it's paid for by the government, but a private insurance company actually handles the administration of it. And those are very, they tend to be pretty lucrative contracts for the companies. So what I was saying is, well, look, if you got an insurance company and they want that fat, profitable, Medicaid contract, why don't you put a clause in there that says, well, if you want this contract, then you have to offer plans, through the exchange as well. And New York actually does that. Andrew Cuomo issued an executive order last year that requires that in New York. And I think Nevada had something along those lines as well, where if you do offer exchange coverage, then it gives you some bonus points or something. They have a scoring system for who wins the contract, and it's like extra credit. It doesn't guarantee that you'll get the contract, but it means that you get more. You're more highly favored to get it. So.
Okay, so one of the things that former President Barack Obama had pushed for was a public option. What exactly is a public option?
Right. So that was a huge controversy at the time, and unfortunately, it did not go through, and that's a real shame. Public option. There's a lot of different ways of doing it, a lot of different definitions, but what it generally means is basically a government-run healthcare or health insurance plan, which anyone can buy into, and because it's offered and paid for through because it's offered through the government, either federal or state. There's not supposed to be a profit motive for one, so that should cut out a chunk of the cost, the expense, and also the other big advantage of it is that there are a lot of rural communities or rural counties where each year there's a danger that none of the private insurance companies are going to bother offering any policies. There's a danger of what's called a bear county where there's nothing available because they just don't see a profit in it. And so a public option would be basically that plan. If nobody else was available, at the very least they would be. And the idea was supposed to be that, well, if they could undercut, on price, the private companies, then people would flock to them, and it would also, the idea is, law of competition, and the idea is that, well, it would force the private companies to lower their rates somewhat as well and keep them in line. That was the idea, and usually the easiest way to implement a public option would be, instead of creating a whole new system or a whole new program, it would be to simply expand either Medicare or Medicaid and basically say, okay, up until now you had to be 65 or you had to be below 138% of the poverty line in order to enroll in Medicare or Medicaid, but now we're going to let anybody enroll, but you're just going to have to pay. So you can enroll in Medicare if you're under 65. It's just that you might have to pay a higher premium, than if you're a senior, or it might even be the same. I'm not sure. Or with Medicaid, right now, Medicaid enrollees for the most part don't pay anything. This would be a public option. There would be saying anyone can buy into Medicaid. It's just you'd be getting the same coverage, which would be 99% or whatever of your health ratings. It's just that you would have to pay a couple $100 a month for it, and it would still be much more comprehensive than a lot of private plans. And there's several states that are looking at both. New Mexico is actually the farthest along in terms of possibly offering Medicaid as a public option, and I think it's a great idea, depending on how it's done. So we'll see. but at the time, back in 2009, 2010, that was supposed to be part of the ACA, and for a couple of reasons, mainly one reason by the name of Joe Lieberman, it did not happen.
What is the difference between lowering the age of Medicare and then offering a buy-in to Medicare?
It's not necessary. There may not be a difference. I mean, it depends on how it's done. You could offer both. You could have it where you lower the age from 65 to, say, 50, but you have to buy in, but you have to... really, I mean, the thing is, again, like I said, people who are on Medicare now, they do pay, premiums and such. It might just be that, well, if you're 50 to 64, then you pay a little more, I don't know. Or enrolled in Medicare. Certainly, you're paying for it. You've been paying for it through payroll taxes and such, through Medicare taxes for your life. So, but basically, it's a mandatory program for the most part. So it might be just a matter of if you're from 50 to 64 that you have the option of enrolling or not. But again, it depends on how it's done. And, and then alternately, you could offer Medicare or Medicaid as an optional buy-in for anyone, which again goes back to the public option.
The Republicans introduced a health care legislation last year. What was their plan about?
Well, they introduced about a half dozen different versions, and each one was worse than the one before. But really, at the end of the day, what it boiled down to was dismantle the ACA and return everything back to where it was in 2009. I mean, that was really what it boiled down to. And in fact, it actually some versions of it were even worse because some of them didn't just try to turn back the clock to 2009. They also tried to go even further and dismantle Medicaid as well. And I don't mean the expansion. I mean, the underlying program, because they were trying to privatize that and lower the thresholds and that sort of thing. But yeah, that's really what it boils down to. Is basically the core of it was, I've written a lot about this, and I've actually made video explainers about this. The metaphor for the ACA is basically what's called a three-legged stool, right? And this came from the Massachusetts plan under Romney, and the idea was that the first leg is, which I call the blue leg, and that is the patient protections. Guaranteed, the guaranteed issue, can't deny for pre-existing conditions, community rating, can't charge more for being sick, no lifetime caps, essential health benefits, all the stuff that the policy have to include, right? Now, if you're going to include all this stuff that people want, and then they love it. Like 80% of the public says that they want to keep all that stuff. But if you're going to do that, that's going to cause prices to go up. In order to keep the prices from spiraling out of control, that's where the red leg comes in of the stool, and that's the individual mandate and the limited open enrollment period. You only have a certain window of time to sign up, and so you can't be in the system, and if you don't, then there's a financial penalty for not doing so. And then the third leg is, well, if you're going to put, basically, if you're going to tell people you have to pay for this coverage, what if they can't afford it? And that's where the third leg, the green leg, that's the subsidies. That's where that comes in. Well, if you can't afford it, we'll give you, some financial assistance now. And again, it was implemented imperfectly. The formula needs to be changed, but that was the idea. And so these bills that the Republicans tried to pass over and over again, what they essentially did was chop away at all of those, at either one or two or all three of those legs of the stool. And in the end, after trying over and over throughout the year, in the end, they were only able to chop off one of those legs, and that was the individual mandate. Yeah, they did cut away at the red leg of the stool last December when they passed the tax bill, and that was also the easiest one to get rid of because that's the one that everybody hates anyway. It may serve a purpose, but that doesn't mean anybody liked it. And so the irony of this is that, in a weird sort of way, the ACA now is almost what Obama was arguing back when he was running against Hillary in 2008, when he said, well, it doesn't need a mandate. So great, you got what you wanted, right? But now we see why that was why she was right about that. So that was last year. This year, because they were not able to do, that was all they were able to get away with legislatively. So this year, what Trump has changed tactics. And instead of trying to change or kill the law through legislation, now what he's been doing all this year is basically the opposite of what Obama did for years, which is make changes through executive order and through regulation. What power, what authority does the HHS department have? What power and authority does he have as president? Without actually changing it legally, what can they do, through regulation? And that's why just today, or just yesterday, you heard that you probably read that they announced these new short-term plan rules, which basically bring back the old non-compliant junk plans. You know, the old plans that the whole point of the stool and all that, the whole point of it was to get rid of those, and this brings them back. Except it does so in a way that does not directly violate the law. It sort of sets it up as a parallel program. So you have two types of, basically you're setting up two markets now. You're going to have one which is comprehensive policies through the exchange, which are expensive but are subsidized. And then you're going to have a parallel track of dirt cheap junk plans that, you know, don't cover much, and there's a lot of shady, small fine print and lots of caveats and gotchas and stuff. You know, basically Trump style plans that are for people who, and so what's going to happen is basically anyone who's subsidized will go for the good plan because it's subsidized, and anyone who's unsubsidized is kind of going to be forced to go for these junk plans. And if you're someone who earns too much to get subsidy, who earns too much to be able to afford the exchange plan, but is also too sick to qualify for the junk plan, you're basically screwed. Because these plans that he's expanding on, once again, they can go back to denying you for having a pre-existing condition. I mean, the reason they're so cheap is because they cherry pick. Because they don't have to cover essential benefits. They can deny coverage if they don't want to cover you, and so forth. So basically it takes an existing problem and it makes it a whole lot worse.
You hear Democrats talk currently about shoring up the ACA markets. What exactly do they mean by shoring up these markets?
Well, here's the thing. There always were problems, with the law. It's a big law that affects a lot of the economy and a lot of people. And anytime you have any law like that, the 1.0 version is never going to be quite perfect. Social Security wasn't, Medicare wasn't, Medicaid wasn't. There's any number of large sweeping acts that have a lot of glitches that have to be worked out, and some are major, and some are minor, and some are significant. The difference is that historically, what will usually happen is the other party will usually grumble and say, "See, I told you so," but then after a couple of years, they'll usually roll their eyes and say, "Okay, fine, we'll help you fix this mess," and they'll fix it, and they'll fix the problems. That has not happened with the ACA because it was passed purely along partisan lines, and the Republicans said it's your mess, too bad, and they went out of their way to do everything they could to not fix the problems, even though some of them would actually be remarkably easy to fix. They just won't do it. Once they took over in 2010 and the midterms, from that point forward, there was just about every change or improvement to the law was done through executive order or through regulatory changes by the HHS department. Basically, Obama was sort of doing what he could around the edges because there wasn't a whole lot that he could get done legislatively. And as a result, a lot of those problems have continued to fester. And now, of course, with Trump in office, now he has. And there's no secret, he was very open about this. He said point blank, "I want to blow it up, I want to explode it, I want it to die, I want it to, and so on." So he has gone out of his way not to just not fix the problems, but to deliberately make them worse. And so what the Democrats have been talking about, and sometimes this gets conflated because you hear a lot of, of course, there's a lot of talk now about Medicare for all or single payer plan. But there's also talk about a public option. But then there's also a laundry list of fixes to the ACA mostly as it stands, which would fix a lot of the problems and improve the situation quite a bit. Even if you don't do something as sweeping as a public option would be fantastic. But even without that, there's a lot that could be done to improve it and strengthen it. And one of those would be, as I mentioned earlier, that 400% cap, that limit for the for the subsidies. Just removing that alone, or even raising it, but preferably just removing that alone would improve the situation for, you'd have several million people who would have immediate relief. You'd have several million more people who have dropped off of the individual market or who never got onto it because they couldn't afford it. Because they earn basically people who are middle class who earn too much to get subsidies but not enough that they can easily afford it. You'd probably get a good 6-7 million new enrollees, boom, just by doing that. And the cost to do that actually would not, it would be, I've seen different estimates, maybe like $10 to $15 billion per year. Now that sounds like a lot of money, but, compared to some of the other things that we're spending money on, that's not much at all, And there's a bunch of other things. There's something called a reinsurance program. I have a list, I have a wish list on my site. It's called If I Ran the Zoo. And it's a list of about 20 things that could be done. Some of these can be done at the state level, and there are actually some states that have done this, or done some of these things. A lot of these, they're smaller, they're not sexy, they don't get a lot of headlines. Some of them get kind of wonky, but sometimes these seemingly minor things can actually really improve things quite a bit. And that's one of the things that the Dems actually have in Congress. They actually have introduced several bills to do some of these things. And of course, they're not going anywhere because it's Republican-controlled Congress. And even if they did somehow get it passed, they'd be vetoed by Trump anyway. So
we're often seeing in the news that health insurance costs just keep going up and up and up. But I keep hearing that ACA market, the plans are stabilizing. How can those be two of the same things?
Well, both are true. Both are true because basically what happened was when they launched the exchange plans. So the other big thing, besides the technical, the website's launching at the end of 2013, these plans that they sell now are very different from the ones that they used to sell. Because again, the ones they used to sell, they were priced lower because they were able to cherry pick their enrollees, right? If they thought you were going to cost too much, they said, hit the road, and they kicked you to the curb. They also weren't required to cover, there were some policies that pretty much covered a lot, but there were a lot of policies that didn't cover much of anything, and somewhere in between. So stuff like mental health services, maternity care. In some cases, there were what are called junk policies where they didn't cover surgery, they didn't cover hospitalization, they didn't cover prescription drugs. So what the ACA did was it said, okay, from now on, to be considered an actual health insurance policy, it has to cover. It had a list of what they call the 10 essential health benefits, and it's stuff like hospitalization, surgery, outpatient care, prescription medication, it's a list of the main things that you would expect. So they have to cover all these things, and you have to cover everyone. You can't, somebody walks through the door and says they want to buy your policy, you have to sell to them, even if it looks like they're about to keel over, And you're also not allowed to charge them more because you think they're going to cost more. And finally, the older policies, they used to also have cutoffs. They would have annual limits or lifetime limits where they'll say, you can only have $500,000 or $1 million in coverage per year or for your entire life, and then you get cut off and you get nothing after that. And, that sounds like a lot of money, but the problem is, a chemotherapy session might cost $20,000, our son, I have a 12-year-old, he was born premature, and so he was in the neonatal unit for about a week or so. It cost like $40,000 a day, So what happened was the policies after 2013, the new policies that had to meet all this stuff, the price did increase because they had to cover more. They were more comprehensive, so they had to cover people. They couldn't deny them for pre-existing conditions and that sort of thing. So the price increased. But at the same time, that's why they also included the financial aid, to help cut down on that price. So basically what happened, so the insurance companies, in 2014, when they had to price, every year they crunch their numbers, and they have to decide how much are they going to charge next year, right? And, it usually would go up, 5%, 10%, go up a certain percentage each year because of, inflation and other things. And that's always been a problem. But then what happened in 2014 is they used to be they had a whole formula that they used. There's an actuarial science, there's volumes written about how to crunch the numbers and figure out how risky they expect, their enrollees are going to be. But starting in 2014, they had no idea, because these new rules about pre-existing conditions and cherry picking and all that completely, they had to throw out everything that, 100 years of actuarial science, they had to throw it out the window and start fresh. And they really didn't know. They knew that it would probably be a sicker population, right? Because they've been denying all these, there's millions of people out there who basically have been suffering for years, sometimes with chronic conditions for years, right? And they knew that a lot of them were going to flood into the market now. And so they knew that the prices were going to go up, but they didn't really have any idea how much. It was sort of throwing darts blindly. So it took a few years. It took about 2 or 3 years for them to figure that out, and so it was ugly for a while. Some insurance companies, some of them went out of business. Some of them, were sort of losing lots of money the first few years. Some kind of broke even. A few got lucky and they actually made money. But it was kind of chaotic for a few years. And so what they would do is they would raise their prices a little or sometimes a lot more each year until they finally reached an equilibrium. And that's what happened. Ironically, that's pretty much what happened last year. And there have been some reports recently from the Kaiser Family Foundation and a few other sources where they've confirmed that basically they were good. Like from their point of view. I mean, maybe not from enrollees, but from their point of view, like they had finally reached the point where they were pricing to the point that they were covering people's expenses and, also had a cushion on top for their, for the profit margin. If that's how it had been left, then basically they would have been, happy. Now on the flip side, of course, is, well, what about the enrollees, right? Well, if you're subsidized, if you're receiving subsidies, what happened was your subsidy went up to match, if your premium went up $50 a month, then your subsidy generally went up $50 a month as well. So the actual amount that most of the enrollees have been paying has actually stayed about the same. It might have gone up a little bit, but it's actually stayed pretty steady each year. The problem is that because of how the subsidy structure, that the formula works, there's a cutoff point above a certain income level, and once you're above that, you get nothing. So the full price subsidies went up and up and up, and the people who are not receiving the subsidies, they're the ones who are having to pay the full price, and those are the ones who are screaming bloody murder. And that's what a lot of this is all about.